Today is Sunday, January 16th, 2022, and this is Flashpoint.
Hi, welcome to Flashpoint. It is nice to be back in the studio this morning. Like so many other Americans, I was forced to work from home for a while after testing positive for the coronavirus. I'm happy to say it was a very mild case, and for that I'm grateful. But I was also disappointed because I feel like I was being pretty diligent. But then again, that diligence included the vaccines and the booster, which helped me avoid the problems faced by so many in the hospitals that are packed across the state. Week after week, I come to you on Sunday mornings talking about our healthcare workers being stretched beyond their limits, and somehow they keep finding new limits to stretch. I don't know how they're doing it. Ahead this morning, we're going to talk with the state's chief medical officer, Dr. Natasha Bagdasarian, about what she's seeing happen across the state. And we'll talk about the report that's due out tomorrow on COVID deaths in the state's nursing homes. Till now, we've understood that about 5,700 deaths occurred in nursing homes and long-term care facilities. But the report says that's an undercount by nearly 2,500 deaths. Is that accurate? Also this morning, the New Year outlook for Michigan businesses, surprisingly rosy, even as some high-profile closures have been announced in Detroit. We'll also talk about the fight over voting rights. 246 years after those most precious American rights were enshrined, here we are battling tooth and nail over how those votes should be cast. By creating rules around how the votes are cast, are we creating rules over who gets to cast them? It's all today on Flashpoint. All right, when we came to you last Sunday morning, we had seen a short run of 20,000 COVID cases a day in Michigan, the highest level since the start of the pandemic. Happy to see those numbers come down a bit over the last week, but many of the state's hospitals remain on a crisis footing, and Omicron is still running rampant. Let's talk about it with the state's chief medical officer, Dr. Natasha Bagdasarian. Doctor, really good to have you back on the program again. And let's start. I wouldn't want to turn this into a roulette table, and because this is such a tough thing to predict. But do you sense that for Michigan, the worst of it's behind us? Are we in the middle of it right now, or is it yet to come?
Well, modeling shows that we're currently experiencing our Omicron surge. We know that just a few weeks ago, we were still seeing mostly Delta, and Omicron has taken over in the state really fairly recently. When we look at modeling based on what academic researchers are putting together around the country, based on Michigan's data, what they're really predicting is that we will peak by the end of January, maybe early February. So we have not seen the worst, I fear.
Yeah, so we're getting closer to that tipping point, though, which would be nice. But it's interesting, a lot of people seem to be building optimism around the idea that if we get past Omicron, we kind of can move home free a little bit. I mean, how do we know Upsilon or whatever, Omega isn't still behind it yet to come? What is our concern about the next variant?
Well, I have to tell you, there will be new variants. There will be variants after Omicron. This is not the last variant of concern that we've seen. Now, what these variants will look like and how they'll behave, we don't yet know. Could they cause milder disease? It's possible. Could they cause more severe disease? We don't know. It really depends on how the virus behaves. Mutations occur every time the virus has a chance to replicate. So the more the virus spreads, the more it makes mistakes and mutations. And we don't know what those mutations will look like or how it will affect how the virus behaves. Yeah.
I want to talk to you about the testing problem. My own experience with it kind of gave me some insight into some of the shortcomings and problems here. I had tested 3 rapid tests that were negative. I had a PCR test that was negative. And only the next day, because I realized I had had another contact with a family member who'd had it, did I finally test that I have a rapid test that was positive. But the gap of waiting for that PCR test was 2 days, and somewhere in the middle of that was obviously when my status changed. It seems to me that our tests are extremely limited by the time it takes to get the results back. And if you're having to wait days for the results, never mind getting enough tests around, isn't a big problem here, the responsiveness of getting the results in?
Well, first of all, I'll say that when you're testing, that test result only tells you your status on that day or
Right.
at the moment that you take the test. So it doesn't tell you what could happen the next day. So if you've been exposed and you're incubating the virus, means that the virus is just taking hold and starting to slowly replicate. The test isn't going to tell you that you're about to develop the disease. So having a ready supply of tests is really vital so that people can test multiple times, as you did. So tests were negative on certain days, telling you that the virus hadn't yet taken hold, and then the test became positive. And that's what we see. We're also seeing that antigen tests may be slightly less sensitive in the early course of disease, which is troubling because we know that that's when a lot of transmission occurs.
Yeah. In fact, when we were talking about testing earlier, I talked about this a little bit with the governor this past week. We are now on the footing of trying to get tests into many more homes and covering the costs of them as well, which is terribly important because these can be really expensive, $25 for a pair of them. But we weren't ready, were we, with the testing, with a robust testing atmosphere that we needed when Omicron hit?
Well, it really, when you look at the entire landscape of testing, we do have testing available. It just may not be the right type of testing for the right situations. So early on in the pandemic, the state really built up our ability to do PCR. So we had labs that were willing and able to perform PCR on fairly large scale platforms. And what we saw was that sometimes when things get really busy, that affects turnaround time. And so testing results aren't available right away. When antigen tests were developed, Michigan was one of the early adopters of antigen testing, and we purchased a large number of those tests and rolled them out to schools very early on. And when over-the-counter tests became available, we also were early adopters and tried to buy those tests early on, but the availability simply hasn't been there. So when we talk about testing as a whole, there is testing available when we look statewide. There is PCR testing available, but does it meet our needs? It doesn't meet our needs in terms of turnaround time, having those test results available right away. It does help us in certain situations. So if someone's going to a hospital and we need to know whether they have COVID for treatment purposes, it may be slightly more helpful. But rapid antigen tests and over-the-counter tests in particular is what we really need. And we need enough of them so that Michigan's residents can test multiple times, as you did.
Yeah, exactly right. And that's to see people waiting in those long lines and then waiting for a couple of days for the results. Clearly, we had to be disappointing to you. Let's talk, though, about shots now in the vaccine. We had a poll, the most recent WDIV Detroit News poll kind of showed us that it's a pretty steady number of people who are insisting they're never going to get vaccinated. I talked to the governor about this a little bit last week. Do you see any way to make inroads, I combined the two, any way where we can kind of chip away at that vaccine resistance that exists not only among people who are on the far right, but clearly among a lot of Detroiters?
One of the things that continues to worry me are vaccination rates in certain communities. And when we look at younger communities in general, or younger populations in general, they tend to be less willing to vaccinate. So our vaccination rates in 20 to 30-year-olds, 30 to 40-year-olds are not great. And then when we look at some specific communities and some specific racial and ethnic groups, the vaccination uptake is even lower. So one of the things that I'm very worried about is that the way that vaccine uptake is not equal across the board, we're leaving some communities very vulnerable to the effects of COVID. And with this Omicron surge, they will be the most vulnerable communities. So we are working on strategies to try to address that, and some very specific communication tools and trusted messengers for the communities that have been left behind in terms of vaccination rates.
I know that you were not in your current position when all of these decisions were made, but we have this report that's due out tomorrow that even before it came out, a lot of people were debating and arguing over its findings, and that was about the nursing home deaths. It was a very controversial policy that was installed early on. It didn't seem to make sense to a lot of people to put COVID positive patients into a very dangerous, it would seem, and vulnerable population like nursing homes and long-term care facilities. But it seems that, at least according to what we're going to see in this report tomorrow, that the count of those deaths that occurred in those places was maybe off by about 1,000 or so. Give me your reaction to what you've heard so far and what we need to do about it.
Well, Devin, it's difficult for me to comment on things that occurred before I was both working at the state and actually before I was even in Michigan. However, I can say that during the pandemic, what we've really seen is that tough decisions have to be made, sometimes with very little notice as we learn new information and as the virus changes. And so this whole pandemic has just been an opportunity to learn and to be as agile and nimble as possible. And it's difficult, I think, to second guess some of those decisions that were made early on in the pandemic when, again, we were still learning about the virus and learning about how it behaved in certain settings.
There will be a fair amount of that, no doubt, though, of course, when that report comes out tomorrow. Dr. Bagdasarian, I really appreciate your time. It's good to have you back on the program. Stay safe, and we'll talk to you again soon.
Thanks for having me on today.